We'd like to now welcome the director of the National Institutes of Health, Dr. Francis Collins, to the broadcast. Thank you for taking time this morning.
I'm glad to be with you, Margaret.
Doctor, you predicted earlier this month that it may well be boosters are going to be recommended for almost everybody. That didn't happen on Friday. Do you still expect broad approval?
You know, we have to see how this plays out over the coming weeks because the data changes every day. I do think it was very significant that the FDA Advisory Committee voted unanimously in favor of offering boosters to people 65 and over and to others who have high-risk exposures like healthcare professionals. So we're starting down that path. They weren't convinced yet that the data required this for younger individuals who aren't at high risk, but I think some of the data we're seeing coming in, especially from Israel, tells me that it's likely that they will get to that point. But this was a start. And I know people were confused about different messages, but in a certain way, Margaret, this is the way it ought to be. Science sort of playing out in a very transparent way, looking at the data coming from multiple places, our country, other countries, and trying to make the best decision for right now. That's what they did.
But as a medical professional, your view is a third dose of the Pfizer vaccine will be necessary for everyone?
You know, yeah, I am a physician, a scientist. I'm not a politician. I'm trying to figure out what's the best answer here. The place that might still be somewhat questionable would be the very youngest individuals. Is the benefit risk needed there? But certainly, I think there will be a decision in the coming weeks to extend boosters beyond the list that they approved on Friday.
So this advisory panel, as you said, gave a green light for 65 and up and those high risk. Who does that actually mean? Dr. Peter Marks, the FDA official who oversees vaccines, put teachers in that high risk category. Do you agree with that?
I think they could be seen in that space. They are, after all, in circumstances, especially if they're in classrooms with kids under 12 who can't be vaccinated, where they are at higher risk of exposure than most of the rest of us. So maybe in that regard, they kind of fit into the same category as healthcare providers. The way in which the FDA panel made the vote, it was a little ambiguous. FDA is going to think about that.
Well, exactly, because you wonder, is it just as risky being in a classroom as a hospital ward? And what does that mean for people like me who live with unvaccinated children? Does that put me in a high-risk category?
Margaret, that is a great question. And I think that is one the CDC will probably have their committee discuss in some seriousness on Wednesday and Thursday. Because, yes, you are in a circumstance with younger kids who can't be immunized where it is more likely that you could be exposed than somebody who's living alone.
We'll watch for that. If someone got the Moderna or the Johnson & Johnson vaccine, and they fit into the 65 and older category, do they walk into their CVS this week and say, give me a third dose of Pfizer? Can you mix and match? And I know NIH is looking at this, so tell me what you're seeing so far.
So we are right in the middle of those trials to see, can you mix and match any one of the three that have emergency use authorization? Can you start with one and boost with the others? We're going to know more about that just in the course of the next 2 or 3 weeks. Right now, we don't have the answer. Moderna and J&J, by the way, have also submitted their booster data, so it's likely that FDA will be able to have a comment on that pretty soon. It's not quite in sync here. So people who got Moderna, that would be including me, need to sort of hang on here and see what the recommendation is for those of us who were interested in a booster. And people shouldn't be rushing out right now and getting a booster before it's actually gone through this process. A fair number of people seem to be doing that. Hang on, people. Let's be clear. The vaccines right now in the U.S. are doing a great job of protecting people against severe disease, hospitalization. What we're worried about is that's beginning to erode, and we're seeing more breakthrough cases, and we don't want to get behind this virus. We want to stay ahead of it.
But the White House did want boosters broadly available this week. Do you still believe they will be widely available this week?
Well, part of the reason for this to get talked about a month ago was to be sure we were prepared. You know, I kind of think about this like when you're preparing for a hurricane. We have a system that starts noticing a tropical disturbance somewhere out there in the Atlantic long before there's a risk that it's going to hit New Orleans.
Right.
This is good. That's kind of what we're trying to do with COVID-19. So part of this announcement that this might very well, if FDA and CDC agreed, be a good thing, was to get all the pharmacies, all of the other preparations together, so there wouldn't be a mad dash at the end
Right.
to try to actually implement this.
Right, which
I
we
think
saw with the Trump
we are in a pretty
administration.
good place by the end of this week.
Okay.
Yes.
Well, so we know that next month is a target for a vaccine to 5 and 11-year-olds. What about preschoolers and the very young? When do you expect vaccines for them?
So the trials on kids under 5 are still going on. The data won't be submitted to FDA for a bit longer. So I think realistically, we're not going to see approval in that space until very much later this year. I wouldn't want to put a precise date on it, though. There's so many uncertainties there about FDA's review and what the data looks like. But as you said, kids 5 to 11, the data's supposed to come in the end of this month, and FDA will be working 24/7 to go through it. So we all hope that can happen in weeks and not months.
Okay, so still potentially within this year for the very young. Quickly, as a doctor, there's going to be a massive gathering in New York City for the UN General Assembly this week. Are you concerned it'll be a super spreader event?
Well, I sure hope not. We've had enough of those, haven't we? I hope people are taking this with the appropriate seriousness as far as vaccines and mask wearing and not doing silly things, gathering indoors with masks off amongst people who are unvaccinated or even people who are vaccinated, since we know they could also be breakthroughs and can be passing it along. So yeah, New York, let's pay attention here. We're in the midst of a Delta surge. It is not a safe place to throw caution to the winds.
Doctor, thank you for your time this morning.